25-year-old male who's brought to the Vanderbilt emergency room by his parents because they fear something is terribly wrong and says that he isn't acting like himself. Jake Blevins denies any abnormal behavior and says he feels great. Mr. Blevins states that around 2 weeks ago he started feeling just wonderful. He describes his feeling as living in a new level and says everything is connecting with him. He describes this state as something that has been given to him by the gods. He recently used his savings to buy a BMW and is planning to travel to Las Vegas to start his career in comedy. Mr. Blevins states that this interest in comedy has become his new life's illumination. Mr. Blevins denies that this behavior is abnormal and thinks he is just fine. He instead believes that the reason he is in the emergency room is because his brother is acting out of jealousy. He believes his brother cannot handle his success and thinks his brother is the one with the problem. Mr. Blevins states he is only here to prove to his family that everything is all right. Upon further questioning, Mr. Blevins has not slept for the last 3 days, but feels that he does not need sleep. He says that despite his lack of sleep, he feels great. The nurse mentions that he seems overly chatty and is noted to make jokes at ill-advised moments. His family states that he has had similar symptoms in the past of elevated energy and lack of sleep. Mr. Blevins' past medical history is significant for a severe state of depression that he was in 3 months ago. It is unknown if he was diagnosed with major depressive disorder, but he was prescribed sertraline. He stopped taking this medicine after 1 month because he started feeling a lot better. His medical history is negative for any substance abuse problems. Mr. Blevins does not have a history of any surgeries, and there are no noted medications that he's currently taking. He has a family history of a maternal grandmother who was diagnosed with maniac depression. There are no other significant family history noted in this case. He denies any use of tobacco or alcohol. He also denies any recreational drugs such as cocaine, PCP, amphetamines, or other stimulants. On physical exam, Mr. Blevins has a heart rate of 90, temperature of 96.8, blood pressure 130 over 80, and a respiratory rate of 60. On mental status exam, Mr. Blevins is a well-appearing young man with mild psychomotor agitation and rapid loud speech. He is dressed in baggy pants with large gold chains around his neck. Mr. Blevins is intrusive and talkative. He is oriented to person, place, time, and circumstance. Memory is fully intact without deficits. His mood is just wonderful. Affect is expansive. Thought content is focused on a comedic career. He denies suicidal ideation, homicidal ideation, and hallucinations. Insight is poor and judgment is poor. For assessment and plan, Mr. Blevins is a 25-year-old male who is in the emergency room because his family thinks something is terribly wrong. High on my differential diagnosis are disorders that are associated with mania. This patient meets all criteria for mania under DSM-5, as the symptoms last longer than a week and has at least 3 of the dig fast symptoms. Diseases in this category include bipolar disease type 1, medication-induced bipolar disease due to a medical disorder, and psychotic spectrum disorders. Other diseases in my differential include bipolar disease type 2 and hyperthyroid. Hyperthyroid is low on my differential as his blood panel is normal for T4 and TSH levels. Psychotic spectrum disorders are also less likely as he does not reach the criteria for DSM-5 for psychosis. Medication-induced bipolar disease is less likely as well since he is not on any medications and since his urine drug test was normal. Bipolar disease due to a medical disorder is also less likely as his history and physical exam are not representative of a medical issue. Also, his metabolic panel and blood work were normal too. Bipolar type 2 is also low because he meets the criteria of mania instead of hypomania, as his symptoms cause social dysfunction. Bipolar type 1 is high on my differential because his symptoms are classified as mania and is not better described by other psychotic disorders. He also has a family history of this disease. He is also suspected to have major depressive events in the past, and when put on sertraline, the medicine seemed to help bring out mania. Therefore, for recommendations, I would recommend the administration of lithium for mood stabilizer and also admission to the psychiatric hospital to observe for psychosis.